For this afternoon, I was tasked to discuss with you the myth regarding the flushing of gallstones. Now, as we all know, gallstone flush or flushing can be called by other names in the internet, advertisement, and social media. And they can be called as either gallbladder cleanse, liver flush, liver cleanse, or liver detox. And they say that doing this can detoxify the liver as well as flush out the gallstones inside the gallbladder. The question is, can gallstones really be dissolved? The truth of the matter is that some gallstones can be dissolved through the use of bile salts, although this can be used only with stones formed from cholesterol and not from bile pigments. We all know that we have three types of gallbladder stones, and they are the following: pure cholesterol gallstones, the pigment type of gallstones, and the mixed type. Unfortunately, we Orientals, including us Filipinos, preponderantly have pigment or mixed type of gallstones, which are not really responsive to the dissolution using bile salts, compared to the cholesterol gallstones found among Caucasians in Northern America and in Europe. Now, UDCA actually can dissolve pure cholesterol gallstones. However, take note that it will depend on the size and the number of gallstones inside the gallbladder. And it may take about months or even years to be dissolved, especially so if you have multiple gallstones or large gallstones. The other aspect is that you have to consider the cost of UDCA in the gallstone dissolution. Now, in our country, 250 milligrams of UDCA costs about 50 pesos per capsule or tablet. And if taken 3 times a day, the cost will be around 13,600 for 3 months, 27,000 for 6 months, and around 54,700 for 12 months. And taking into consideration that it's not really a guarantee that the gallstones will be dissolved or flushed out of the gallbladder. Now, the other question is, can gallstones really be flushed out? And the myth is that gallstones can be treated without surgery, basing on the following premise: gallbladder cleansing or flushing, drinking of apple juice or apple cider vinegar, milk thistle, eating of artichoke, taking in gold coin grass, which is actually a Chinese herbal medicine that you can buy even online, and yoga. We have to remember that all of these have no good randomized controlled study that will say that they are really effective in treating gallstones without surgery. About gallbladder flush or cleansing. Now, actually it involves consuming a blend of apple juice or cider, herbs, and olive oil for about 2 to 5 days. Recipes actually vary, and some procedures will allow a person to food, while others will not allow them to eat, and they have to be fasted. And previously, Epsom salt or magnesium sulfate was added, but recently this has been discarded in the formulas because it can produce diarrhea. Now, the stools of patients after a gallbladder flush will look something like this. And the myth is that the gallstones are being flushed out from the gallbladder and out through the stool. The truth is, these are actually globs of oil, juice, and other materials, not really gallstones. And there was a study done and published in Lancet with the title, "Could This Be Gallstones?" Now, the microscopic examinations of these patients' alleged stones actually revealed that they lack any crystalline structure, and they melt to an oily green liquid after 10 minutes at 40 degrees centigrade. And they actually contain no cholesterol, bilirubin, or calcium by established wet chemical methods, which means that they are not really gallstones. They also experimented using or mixing equal volumes of oleic acid, which is actually the major component of olive oil, and lemon juice, which produced several semi-solid white balls after the addition of a small volume of potassium hydroxide solution. And they have concluded that these green stones, quote unquote, resulted actually from the action of lipase on the simple and mixed triglycerides that make up olive oil, which yield long-chain carboxylic acids, mainly oleic acid. And this process was followed by saponification or formation of soap stones through the action of potassium carboxylate, which is actually the main component of lemon juice since it contains a high concentration of potassium. The other problem is that fatty foods, which can be seen when you drink a lot of olive oil, can produce gallstone impaction in the common bile duct. And gallstone may migrate from the gallbladder to the common bile duct due to the effect of vigorous gallbladder contraction after a fatty meal. Now, complications actually can occur after the gallstone has migrated from the gallbladder into the common bile duct. And in some of our patients, we've seen gallstone pancreatitis after a gallbladder flush. We've also seen obstructive jaundice, which can actually even result to biliary cirrhosis if not treated within months. Cholangitis or infection in the biliary duct can also occur, and of course, after this, sepsis may also be a complication of gallbladder flushing. So the question, is gallstone flushing recommended? I guess the simple answer is really no. And please do not recommend or do gallbladder flushing on yourselves even. And the reason is that it is really a myth, and claims of benefits are actually really misleading. And of course, we go back to our Hippocratic Oath, which is actually primum non nocere, first do no harm, meaning that if we cannot help our patients, at least we don't do them any harm.
Good afternoon. Thank you for inviting me to be a part of this postgraduate event. My topic for this afternoon is alcohol in moderation. Alcohol forms an important role in our lives. In most important occasions, we toast to cheers a newlywed couple. We drink to celebrate birthdays and anniversaries. And then we even drink to enjoy just the company of friends. On the other hand, when we are sad and when tragedy strikes, we drown our sorrows with alcohol. Alcohol in moderate consumption have some health benefits. It has been shown by several studies that it decreases the risk for ischemic stroke, peripheral vascular disease, and sudden cardiac death by 25 to 40%. It even prevents the development of type 2 diabetes mellitus and the formation of and this is being attributed by the following mechanisms: increased high density lipoprotein, increased sensitivity to insulin, and the improvement of the tissue plasminogen activator that modulates the clotting factor, thus preventing the formation of blood clot. It has all, aside from improving your digestion, moderate consumption of alcohol can trigger the release of your endorphins, thus producing a calming effect, providing respite at a stressful day, at the end of a stressful day, and it has a tonic effect that produces less pleasure and satisfaction, especially in drinking with friends and loved ones. However, for us to have the benefits of alcohol, it has to be in moderate. It has to be consumed in moderate amount. And before we can define what moderate drinking is, we need to define as what is a standard drink. A standard drink defined by the Center of Disease Control in the United States is defined as 360 cc for a can of beer which contains 5% alcohol, 240 cc for liquor which contains 7% alcohol, and 150 cc for wine which contains 12% alcohol, and 45 cc for strong liquor which contains 40% alcohol. Moderate drinking is defined as 2 drinks or less per day for men and 1 drink or less per day for women. Moderate drinking also is not based on the alcohol consumption alone. It is the pattern of drinking that matters. So that when you drink per day, we drink per day for a week, it's not it's not equivalent to 7 drinks in a Friday night. It is already considered binge drinking, which is defined as 4 to 5 drinks in a single occasion within 2 hours. Heavy drinking is defined also as consuming 15 drinks or more per week for men and 8 drinks or more per week for women. With heavy drinking comes the harmful effects of alcohol. Alcohol can destroy your liver and your heart. It is also associated with the development of different forms of cancer, especially cancer of the breast. It can lead to dependency and alcoholism, leading to abuse and violent crimes. It can impair your judgment and coordination, and it is reported that 20 to 30% of vehicular accidents are related to alcohol. So the policy of if you drink, don't drive should be followed. If you are in your 50s and with comorbidities, it can interact with your other medications. Alcohol also contains twice as much calories as your soda and can lead to obesity. It also aggravates and causes depression. Genetics has also been found to have a role in the influence of alcohol in cardiovascular disease. Those moderate drinkers that has a low metabolizing enzymes will be will have a lower risk for cardiovascular disease compared to those who have fast metabolizing enzymes. Estrogen, genetics, and alcohol are also related in the increasing the risk for the development of breast CA. Estrogen can increase alcohol can increase the level of estrogen and decrease the level of folic acid which is needed for cellular development. So to drink or not to drink requires balancing the risks and benefits. And since every person is unique with his own personal and family histories, you need to assess yourself whether alcohol for you is a tonic or a poison. Thank you and God bless.
Good day, everyone. Let me start the session by asking you a question. Long or short, loud or silent, how many times do you fart in a day? The answer is 14 to 18 times. The range of normal bowel movement frequency is 2 times a day to 3 times a week. And there are over 400 bacterial species in our fecal material. And there are about 100 million bacteria per gram of human wet stool. Many people believe that chronic constipation or colon fecal accumulation is unhealthy and leads to a number of symptoms and diseases, including colon and other malignancies. Thus, colon should be cleansed regularly to free it from fecal material. Which leads us to the question, is colon cleansing beneficial or is it just a myth? The concept of colon cleansing dates back to the ancient times and is rooted in the auto-intoxication theory, which states that stagnation of the colon with feces causes toxins to form, and these are absorbed into the system and can poison the body. Thus, to promote and maintain health, we need to cleanse our colon. Colon cleansing can be carried out anywhere, whether done in a fanciful spa setting or right in the comfort of your own bathroom. Central to colon cleansing is the pail, the tube, and of course, water. Colon hydrotherapy uses tubes to inject water, sometimes mixed with herbs or other liquids into the colon via the rectum. This removes unspecified toxins by removing accumulated feces. Colon cleansing, colon irrigation, colon hydrotherapy, whatever name you call it, works like an enema. The patient lies on a table and water is pumped in and out of the colon via a tube. However, unlike an enema for which a small amount of fluid is used, for colon cleansing, we use up to 60 liters of fluid, and these are pumped into the large intestine of the patient. Coffee enema, I'm sure you've heard of it, is a variant of the colon cleansing hydrotherapy. This is especially popular in Latin America. Shown here is a coffee enema commercial touting its health. Its proponents claim that caffeine absorbed in the colon leads to vasodilation in the liver, which in turn enhances the process of colon or toxin elimination. Colon hydrotherapy has its share of adverse effects. Mild effects include cramping, abdominal pain, fullness, nausea, vomiting, perianal irritation, and soreness. Severe symptoms or adverse effects include fatal euphorsia or accumulation of gas in the mesenteric veins with air embolization, rectal perforation, pelvic abscesses, perineal gangrene, aplastic anemia, hepatotoxicity, acute water intoxication, renal failure, colitis, and even septicemia and death. Serious infections were due primarily to inadequately cleansed devices and contaminated solutions. A host of colon cleansing products have flooded newspapers and social media. These are ubiquitous on the internet, and they take the forms of laxatives, teas, powders, capsules, oral tablets, and suppositories. Contents include the sodium phosphate, probiotics, enzymes, herbs, fibers, laxatives, milk thistle, and licorice. Ingredients of common oral cleansing preparations and their proposed mechanisms of action are listed below, with effects ranging from promotion of bile flow, aiding of liver detoxification, to stimulating bowel movement and diuresis, stimulation of digestion and blood flow to abdominal organs, anti-inflammatory effects, anti-irritation, and motion of digestive secretion. But are these really beneficial? The concept of colon cleansing has been dismissed by medical societies as a waste of time. The American Medical Association and the U.S. Gastro Societies have condemned the practice as money down the drain, gastro quackery, triumph of ignorance over science. But due to the social media and newspapers, it has staged a comeback and is now a billion-dollar industry. So where is the evidence then? The search of literature using the terms colon cleansing, colon detoxification, colon irrigation yielded no scientifically robust studies. The U.S. Natural Standard Professional Database note that there is limited clinical evidence validating colon therapy as a health promotion practice. Note that there is lack of sufficient evidence for most of its prescribed users, according to them. The practice of colonic cleansing to improve or promote general health is not supported in published literature and cannot be recommended, as mentioned by Acosta in the American Journal of Gastroenterology. With that, I would like to thank all of you for your kind attention.